Hi everyone, my name is Stephen Kavanagh, and today my project is on elderly swallowing disorders. So a swallowing disorder, also known as dysphagia, is fairly prevalent in the older community. As many as half the elderly population will deal with a swallowing disorder at some point in their lifetime. If untreated, it's believed to be able to take 6 months off a person's life. So what is dysphagia? Dysphagia can be defined as difficulty swallowing liquids, foods of various consistencies, or drugs. It can be broken down into two separate categories: oropharyngeal dysphagia and esophageal dysphagia. Oropharyngeal dysphagia is described as difficulty transferring food from the mouth and pharynx to the esophagus to initiate the swallowing process. Esophageal dysphagia is described as difficulty passing food through the esophagus. The process of chewing and swallowing requires at least 6 cranial nerves, the first 3 cervical nerve segments, and the 26 muscles of the mouth, pharynx, and esophagus. Now, if any of these parts aren't working properly, it could be a leading cause to dysphagia. So what are some of the signs and consequences? Well, there are various signs to watch out for when it comes to dysphagia. Some of the more common ones are constant clearing of the throat while eating, excess drool or saliva, a choking sensation even when they aren't physically choking, and regurgitation, as some foods may be harder to manage. In many cases, dysphagia can lead to malnutrition, dehydration, and weight loss. The issue increases their likelihood of falling and injuring themselves, and with lack of proper nutrients and vitamins, dysphagia can prolong the healing time of wounds, which can eventually lead to other diseases, ailments, and even death. So how does this happen? Well, there are numerous reasons that a swallowing disorder could occur. It can be as simple as the body aging and deteriorating, such as loss of teeth and motor skills. It can also be linked to neurological reasons such as dementia, stroke, Parkinson's disease, cancer, and tumors. So who do we turn to for help? Well, the management of dysphagia often requires input from different members of the healthcare team, including but not exclusive to speech and language therapists, dietitians, ears, nose, and throat doctors, neurology or gastroenterology specialists, depending on the underlying cause. Doctors tend to turn to the Modified Barium Swallow Study. A real-time fluoroscopic motion study is the reference standard to assess swallowing physiology involving the oropharynx and esophagus. So to perform a barium swallow test, the patient ingests the barium while their upper gastrointestinal tract is having an X-ray done simultaneously, showing the results of what may be causing the issue. This test is useful for specialists to see what may be causing dysphagia and is a helpful tool in determining what dietary requisitions may be suggested to the patient in order to safely eat and drink. Now looking at this photo, we can see the upper GI tract is highlighted. Now, ideally, that's what the barium will do while the X-ray is being done. So depending on the severity of the swallowing disorder, patients may be required to make a change in their diet. By doing this, they will ensure that they will be able to safely eat and drink. In many cases, a mechanically altered diet may be required, which is a change in consistency and texture of the food and drink they're consuming. Mechanically altered diet is defined as diets that contain foods that have been mechanically altered to modify texture or consistency. The foods may be liquid, puree, ground, chopped, minced, or tenderized. Now, changing the consistency of food and drink can be a challenge when looking for the right texture. With that in mind, a global team of professionals came together and created a standardized system known as ITSE, which can easily be translated around the world, ensuring patients receive proper thickness of their meals. The ITSE chart can be broken down into 2 segments, one for liquid and the other for food. Now, what are some other treatment options? Well, there's medications, throat exercises to strengthen muscles, learn a new technique to swallow, essentially a different motion of passing food through the upper GI tract, and surgery. Now, in conclusion, there's still a lot of gray areas when it comes to diagnosing a swallowing disorder, especially in the elderly population, as there are many underlying causes. Each case is unique in their own way, which can make treating an ailment like a swallowing disorder difficult. Dysphagia in our elderly community is a growing concern, and as we see the number of cases rise each year, it is important for them to have the proper outlets to receive help, support, and treatment required. The same can be said for those who set out to help them. Although there is no certain way to prevent a swallowing disorder, it is becoming something that is much more manageable, ensuring that our senior population can maintain the quality of life they deserve. Thank you.